Minister, what's your view on whether the WHO should go phase 6 now that the virus is spreading more freely in Japan, and particularly in Australia, the cases have doubled in the last 24 hours. What's Singapore's view on that?
Yeah, I think WHO has now acknowledged the limitation of their alert system, because by just focusing on numbers, it serves some purpose that you know that it's spreading easily and it's spreading all over the place. But I think there must always be a second dimension, which is it deadly? How severe it is? I mean, there are other kinds of pandemic, you know. I can say that obesity is pandemic globally. But people still go to the junk food and so on. So I think mere geographical spread is one dimension, but I think not adequate. And we went through this when a few years ago when we were deciding on our own color coding. I was involved in that exercise. So we deliberately introduced a second dimension, which is severity. And therefore, that's why our color code is not identical with WHO's 1 to 6. So our first few colors coincide with the first few WHO alerts, because that has to do with spread, and at the beginning of an outbreak there will be great uncertainty. So better assume the worst and hope for the best. But subsequently you can then begin to decouple, and you should decouple once you know the disease better. And locally one must always decouple, because sometimes local situations may be different from the other parts of the world. So I think there are good reasons for countries to have different and not identical alert system with WHO, depending on the purpose that's how you define your alert system. What was your question about Australia, you're saying?
Well, I was just saying that the number of cases in Australia has doubled in the last 24 hours. So there's
doubled from a very small base, you know.
Sure, yeah. But there's evidence now that the virus is spreading outside of North America, which is the criteria for WHO going to phase 6.
Yes.
Have you communicated that view to WHO, that you think there should be a criteria of severity?
I think those was discussed at Geneva. That was discussed in Geneva last week. WHO was having meeting last week, so that was one of the limitations.
And Singapore communicated
that was touched. I was not there because I was here, but our representatives were there. But from the report that I read, I think the limitations of the WHO alert system are now quite well acknowledged. So I'm quite sure once the dust settles and we will have time to review this alert system. But for Singapore, we just look at our own local situation, and I would say our color coding remains appropriate. But even then, each crisis is a learning opportunity. So we develop our color coding, of course, very much SARS-centric. Yeah. So now that you have this different flavor of an outbreak, I'm quite sure we will refine our criteria too, and along the way, we learn. Yeah.
Which GP clinic was involved in calling 993, and what do you think the performance of?
I'll praise him. You know, I'll give him 10 upon 10. Good judgment, and also an alert, because you could have the patient just walk past and that's it, you know, and send her back or ask her to go to the Tan Tock Seng by yourself.
So was there any risk of community transmission when she travelled from the airport to her home? Did she take public transport or anything?
Yeah, I thought I just said her friend picked her up. So in her private...
Will orders be issued again?
Sorry?
Will home quarantine orders be issued again?
Issued to who?
As in, will MOH start issuing home quarantine orders?
Oh, we have been issuing home quarantine.
Yeah, but I mean, because of Mexico, they were no longer sent to Aloha and everything. Only
No.
They were sent to Aloha, but
No. We have issued many HQOs in the last few weeks, because there have been Singaporeans who were in close contact with confirmed cases in Japan, in Hong Kong, in China. So this time round, the international cooperation was very good. So I mean, like in this instance, within hours we inform other countries. Like for example, these 60 passengers, some of them will be traveling to other airports. So once we confirm the details, we'll be informing other airports. So countries have been very cooperative, and we have been getting names of Singaporeans or travelers to Singapore who have close contacts, and so that when they come, we will home quarantine them. And most of them are Singaporeans, so they quarantine at home. And so far, I think Aloha remains vacant, open for business.
So if I can ask you my earlier question more directly.
What is it? Yeah, sure.
As Health Minister, what is your reaction to university authorities who should know better sanctioning a trip to affected place?
I do not know exactly what the study trip is about. If it is something which is very essential and time sensitive, it has to be done. Maybe that's the reason. I do not know. So very hard for me to judge. But if you ask me as a friend who is planning a holiday to go to New York next week, I would say, why don't you consider some other places? Because it's an unnecessary risk. Bottom line is an unnecessary risk.
The dose strain we found in this case, is it the same as elsewhere?
Genomic analysis will take some time, but I think so far the genome analysis of all the other outbreaks outside of Mexico suggests that they are still the same strain. But viruses, they mutate, they keep on. There's always some subtle differences. It's just like human beings. We are all human beings, but there are subtle differences between me and you, and her and him, and so on.
Can we have the name of the GP clinic, commend this clinic?
Sorry?
Can we have the name of this GP clinic to commend them for that?
Because it depends on whether he or she wants her clinic to be reviewed, because they may have other considerations. So all I can say is, this is a wonderful GP. I give him 10 upon 10.
But we understand that the clinic is closed today. Is it under
Is that so? So you know the clinic? No, please. No. We did not close down the clinic. I think it is normal of him to close the clinic on Wednesday.
So is he also under home quarantine?
Not necessary. Not necessary. Why should she? Why should he or she?
He was in close contact with
No, but in the clinics they would have masks up or whatever, So in any case, close contact means, yes, we are now very close contacts, but also prolonged contact, So so it is not as if half an hour, you will have it.
Yeah. How serious was the girl's condition when she was on the plane?
I think she started coughing while on plane, and then I think when she reached home, then I think fever started, etc. So she obviously felt very...
So was it the beginning stage or a middle stage or...
I do not know. You have to ask the doctor.
So the screening system at the airport was quite ineffective in this case.
No, as we said, the thermal can only pick up if you have developed fever, and it is typical of influenza that first of all, 1/3 of the cases may not even develop fever at all, and those that develop fever, it takes time to develop fever. So it depends on at what stage you land at the airport. But it will pick up cases, as it has picked up cases in many other airports. So although it cannot pick up 100% of cases because of the nature of influenza, I think it does not mean therefore that we should not have temperature screening, because to begin with it's quite a simple process.
Question on vaccines. Has Singapore placed an order for vaccines yet? And if not, or if so, with whom? And if not, what are the arrangements for placing that order?
This is early days, because I think it was just yesterday when WHO issued recommendations on, if you are a manufacturer thinking of producing this vaccine, because there are various types of strains, so which particular strain should you be using? So they have just issued that recommendation a few hours ago. So I'm quite sure all the vaccine producers now are busily taking a look at this. And of course, in due course, which may be a matter of days or weeks, they will start deciding when or how much to start producing. In the case of Singapore, we have a contract with an Australian vaccine manufacturer, a very large one. So it's up to us to decide when we want to start placing the order. So these are issues that we'll be thinking through over the next few days or even next few weeks as we get better information about this virus. Because each day we learn. This is about 5 weeks, and We learned a lot more than 5 weeks ago. And I'm quite sure the next 3 weeks, we will learn a lot more about the virus as well. Because it is not a simple solution of just placing the order. Manufacturer will be very happy if you start placing an order, and a huge order. But you have to think about, should you then produce one based on this strain, especially if the strain is mild, or should you then wait to see whether how it mutates over the next few days or next few weeks, which will be more lethal, and therefore the vaccine will then be more effective? And then if so, how much to stock up? And having placed the order, then when do you make the decision to start jabbing into people's arms? Because like all vaccines, there are side effects. So this is a brand new novel virus, therefore the vaccine will also be brand new. So what is the safety record like? Remember not too long ago, in the 70s, when US had a swine flu, so on hindsight, of course, they went a little bit too early in producing the vaccine and in fact promoting mass vaccination. And as it turned out, the vaccine killed more people than the swine flu, which projected to kill, and became a big issue in the US. This was in 76. So these are difficult decisions that public health authorities like ourselves, we have to debate through with the scientists and the experts. It's not an easy decision to make, and judgment has to be made.
Just to confirm, that contract is with CSL?
Sorry?
That contract is with CSL in Melbourne, is it?
Yeah, CSL, yeah.
Sir, sorry.
Sorry.
Do you have any idea how this patient actually was infected and whether the other students were similarly exposed? Is there a high chance that they might be infected as well?
I think in due course, because the poor girl is being interviewed, and I think let her get well, and we have got quite a sufficient basic information for us to act from public health point of view. But I'm quite sure over the course of the next few days, we'll get to find out more information.
Can we find out her condition now then, and when she's likely to be discharged?
Yeah, the doctors told me that she was nothing to worry about, very stable, no underlying medical conditions. So by probability, I think her recovery should be uneventful. But if you look at cases elsewhere, patients were also hospitalized for a few days. So it's not as if we can expect discharge very quickly. Yeah.
For those on home quarantine order related to this case, have they been sent to Aloha, or are you keeping them at home?
They are all at home. For those cases that we have contacted so far, because they are Singaporeans, they have homes to go back to.
How long would they have to be quarantined?
7 days. Yeah. All right.
So, what does this mean for Singapore?
What does it mean for Singapore? Yeah. I think, what does this mean for Singapore? Huh? You want to reply, yeah?
No. Basically, it's here, and people have been lulled into believing for a long time it hasn't come yet. Now that it's here, there might well be a sense of panic among Singaporeans.
No, it should not be. That's why I said we have been lucky in having these 5 weeks of no cases. And the 5 weeks have been very useful. First, from public health point of view, it helped us to gear up our systems. It certainly helped those GPs who forgot to stock up their N95s. Now that the market is open for the last few days, I hope they did stock up this second time. And more importantly, prepare the ground so that Singaporeans, I don't think, should be alarmed or panicked now that we have the first case, because I've been warning about this for many weeks now. And let me continue the warning, because this won't be the last case. Because unless you stay banned traveling to the rest of the world, then we always keep on circulating from Ang Mo Kio to Punggol. Even then, you have travelers who come here to work. You cannot stop them from coming. So I think let's be practical. This is really a type of influenza, and we all know influenza spreads easily, and it's been around. I'm quite sure influenza virus will outlive mankind. So, and it will continue to mutate and so on. So the only way to protect yourself is, my message. Wash hands, seven steps. Don't touch your mouth and your nose. And keep healthy. Because at the end of the day, it's about immune system. I mean, we all know this. When you are heavily stressed and whatever, you fall sick easily, get a cold or get flu. And the same thing here. So although in this particular instance, that's why the earlier point, what was puzzling is somehow the young people get it more than the older folks. Yeah.
So for the other 18 students overseas, what they expected to come in?
Yeah, I think they have their own plan. So whatever it is we have or will be, if not already had, we have to get in touch with all of them and give them the advice. And then when they come back, I suppose we will have welcoming party for them.
Would you be calling them back straight away?
Sorry?
Would you want to call them back straight away?
I don't think it's necessary because they have...
Stay out your quarantine.
No, I think more importantly is if they are unwell, they should not travel. I think that is good advice for all travelers, whether leaving Singapore or coming to Singapore. If you are unwell, please don't travel because it's not fair. You are subjecting your fellow travelers to an unnecessary risk. If you turn out to be infected, then 60 of them will be quarantined. It's so unnecessary. I think let's be fair to each other and be responsible. I think that's a much more important advice. All right, okay.
So just one more question about the vaccine.
Vaccine, yeah.
The company you mentioned in Melbourne has actually, I spoke to them yesterday, and they're actually starting to produce vaccine for clinical trial purposes.
Yes.
Would you be looking to do a clinical trial here, or would you be relying on data from trials done elsewhere?
I think we have our contract allow for various things to do because it is in a way like a partnership, and that was the arrangement we signed on a few years ago. And of course that time the whole emphasis was on H5N1, so we never knew that turned out to be it's H1N1. But the contract is similar. So we have been in touch with them, and because at the end of the day, the vaccine has to be registered here, so therefore we need all those data, and if it includes the need for clinical trial in Singapore, surely that has to be done as well.